reports.
Your procedure involves a day case.
Michael Robinson is being prepped for theatre. At 67, he's living with a condition called atrial fibrillation, which causes an irregular heartbeat, tiredness and shortness of breath. Symptoms can be sudden, even when he's resting.
I was to go on holiday, I had to pull out, went to a wedding reception, had to come home after half an hour.
Michael's treatment has been trialled at Belfast's Royal Victoria Hospital since September. More than 60 people have been through the day procedure. Other benefits include patients are sedated instead of anaesthetised, which increases the number of patients who can be seen and the speed of recovery.
We're nearly ready to get going.
More than 1.5 million people in the UK have this heart rhythm disorder. With an increased risk of stroke and heart attack, timely treatment is critical.
This is steerable, so we'll be able to move this to help get into each one of the individual veins in turn. So that's the size of the hole that we puncture across the heart.
It's the technique that makes this treatment different. Once sedated, surgeons make a small hole in the patient's thigh where they insert a catheter, which is guided meticulously through blood vessels to reach the inside of the heart.
You can see the silhouette of it. So what we have to do is prep this and get it all ready to record.
Once there, another hole is made to access the heart chamber. An inflated balloon positions metallic strips to conduct electrical pulses to mend the damaged tissue that's causing Michael's irregular heart rhythms. The old way froze the affected area, which could cause gastric upset.
This is this patient's loop recorder, which is measuring his heart rate all the time and will record events if his heart rate goes too slow or too fast. This is a sheath that is in the venous system and is now across the atrial septum into the left atrium. This less invasive intervention is not only critical to managing the patient's condition, but it should improve their quality of life. Medics say making the health service more cost-effective is a constant challenge. Watching on from England, some hospitals there are preparing to roll out the procedure.
Much more efficient for the health service. We do same-day discharge, so we only need a day bed. Patient comes in the morning, about 6 hours later they go home. And they can't drive for 48 hours, and then they're back driving, fairly much back to normal life.
Arriving at breakfast, by tea time, Michael's ready for home.
It felt like about 5 minutes, really? But it was a lot longer, and truthfully, no pain. I feel great.
While employing new innovative technology is expensive for health trusts, if it prevents more complicated conditions, in the long term, everyone benefits. Mary-Louise Connolly, BBC News.
Let's talk more about this with Dr Riyaz Somani, who is a consultant cardiologist at Glenfield Hospital in Leicester. We were just chatting, Dr Somani, while we were watching that report. You've done thousands of procedures going in through the leg and up to the heart, but about 15 of this, you said. How revolutionary is it?
Yeah, I think a big step change in our ability to treat atrial fibrillation. The technology introduced by Abbott called Volt, we've done our first 15 cases in Leicester, allows us to deliver the apparatus into the left atrium of the heart and to target the areas in the heart where atrial fibrillation arises from. What's different about this technology is historically we'd been using either burning or freezing type of technology to destroy that bit of tissue in the heart that generates atrial fibrillation. This newer technology is called pulsed field ablation, or PFA, and it's much more cardio-selective, much more precise in terms of the areas that we're zapping, as you described it earlier.
Sorry, not very technical.
So it's much more precise and localised, and therefore the risk of damage to adjacent structures close to the heart, so for example the food pipe, the esophagus lies very close to the heart, the risk of damaging those types of structures outside the heart is substantially lower. The other main advantage of this technology is it's relatively simple to use. So it's a balloon-based catheter, which means it's relatively easy to manipulate within the chamber of the heart where we're trying to get to different areas in that chamber to target. So a relatively quick procedure. So procedure times are in the order of 2 hours or less. And again, the other real big step change in our ability to deliver this treatment is that we can now do it under local anaesthetic and sedation. And for a healthcare system such as the NHS, where we're often quite challenged with the availability of anaesthetist and anaesthetic support, being able to do this under local anaesthetic and conscious sedation is...
I'm sorry, I didn't mean to interrupt. I apologise. The heart continues to beat throughout all of this.
Absolutely. So, and again, we've been doing procedures under local anaesthetic and sedation for a number of years, but this pulse field ablation, up until press, has been quite uncomfortable for patients, whereas this newer technology with Volt is very well tolerated under local anaesthetic and sedation, and, as I said, is delivered within 2 hours. It means we're able to get through many more patients. So historically, we would have done 2 patients per day. We can now ramp up and do perhaps 3 or 4, which obviously has major implications for our NHS waiting lists.
Yeah, because I mean, I was looking at how many people have this condition, about 1.5 million people. So that's a lot of procedures that ideally you'd be able to carry out, and this is going to help you do a lot more.
Absolutely. Obviously, not all patients that have atrial fibrillation are suitable for an ablation type strategy for atrial fibrillation, but for those there is undoubtedly a significant waiting list, and being able to ramp up the numbers of patients that we can get through our doors and offer this treatment to is huge.
I mean, how serious is the condition?
How
serious is the condition?
So I look after lots and lots of patients with atrial fibrillation, and it's quite varied in terms of the presentation. For some people, it can be hugely debilitating. They may struggle to get out of bed, work, drive, go on holidays. It can be massively intrusive. The other big factor with atrial fibrillation is that it does come with an increased risk of stroke, and that's a major additional factor to bear in mind. So a lot of our patients, we will assess and address that risk of stroke. A lot of our patients will go on to blood-thinning medication to help reduce that risk of stroke. That doesn't take away the symptoms that go with atrial fibrillation, and procedures like ablation, along with other lifestyle changes that can come into the equation, can go a long way to help treat and alleviate symptoms related to AF.
And what causes it? Is it something that you can develop, or is it something that you are genetically predisposed to?
A really good question, and our understanding of that is evolving all the time, and I think it's both of those elements come into it. So I think there is likely to be a genetic component for certainly some of our patients that develop atrial fibrillation. We're not at a level where we're so sophisticated where I can do a blood test and say you're going to develop AF and you're not, but our understanding of genetics is increasing, and there is likely to be a component there. In addition to that, we know that there are other things that come into the equation. So, for example, being overweight, being obese, having high blood pressure, obstructive sleep apnea. There are various conditions that go hand in hand with atrial fibrillation, and targeting those and making lifestyle changes can go a long way to help reduce the occurrence of atrial fibrillation. Alcohol is another important factor for predisposing people to atrial fibrillation.
And once they've had this procedure, is that it? So is that basically it sorted?
So, ablation procedures, it's not a slam dunk guarantee, and I think that's fair to say. It works about 80% of the time in patients that have atrial fibrillation that comes and goes. Some people will require more than one procedure, and we're again noticing and appreciating that even patients that I've carried out an ablation procedure on 10, 12 years ago and have done really well without any atrial fibrillation for 10, 12 years, and now potentially coming about with recurrences of atrial fibrillation because it is a chronic condition. It's not necessarily a curative procedure, but the hope is to buy several years of freedom from symptoms of atrial fibrillation with these types of procedures using this technology from Abbott.
It's really interesting. Thank you so much for coming in to talk to us. We really appreciate it. Dr Riyaz Somani from Glenfield Hospital in Leicester.